So we are going to get started with Dr. Karen Sheppard, and she's going to talk about how to work with animal control in your Board of Health. Dr. Sheppard pursued a career in veterinary medicine because of her passion for animals. She's a 1992 graduate of Auburn University's College of Veterinary Medicine until she accepted her current position as director of Huntsville Animal Services Municipal Shelter in the fall of 2002. Karen practiced small animal medicine and surgery. By 2015, Huntsville Animal Services had succeeded in significantly reducing suffering in the community, largely through the creation and funding of a low-income pet sterilization program in 2008, which lowered animal shelter intake from 10,000 to 5,000 animals. By adding a community cat diversion program, lowering adoption fees, and being transparent, the shelter staff is now striving to be fully engaged with the community. The ongoing goal is to continue to improve in order to save every life possible and prevent needless suffering. Karen completed a year-long Maddie's University of Wisconsin-Madison Shelter Medicine and UC Davis Court Shelter Medicine Fellowship. Boy, that's a long fellowship wording there. Wow, impressive. Which provides shelter veterinarian fellows with additional training to help them deliver life-saving knowledge and services to our nation's homeless pets. Currently, Karen's family consists of dogs, cats, horses, a pet llama, pet steer, plus 7 parakeets, and her animal-loving, tolerant husband, Fred. In her free time, she enjoys spending time with horses, clicker training, hiking, and iPhone photography. Wow, that's a big house full of animals and then the tolerant husband. So Karen, Dr. Sheppard, I'd like to welcome you to the conference, and we're so looking forward to your presentation.
Okay, well, good afternoon. I know everyone's had a quick lunch break, and I just want to introduce myself. My name is Karen Sheppard. I am a veterinarian, and I'm the director of the animal control agency, Huntsville Animal Services. We're a city municipality, and we handle right around 5,000 animals a year. And I was asked to speak on this topic of how to work with animal control in your Board of Health because, you know, I'm animal control, and we've been doing pretty neat life-saving work in our community now right at 7 years. I was just counting them up as I was going through and practicing this speech this morning. But anyway, I added a little bit to the topic, and here's just kind of what we're going to talk about specifically is how do you, in whatever various role you're in, start a return to field program in your area. It's amazing to me because I want these return to field programs to be really easy to start because they're absolutely amazing for life-saving and humane care. But I think that there's still areas and places, and it's difficult. And so much of the difficulty is that you have your goal for life-saving, but there are so many different other players that have to come to the table and agree, and they have such different perspectives. It doesn't mean that they're not huge cat lovers or want to preserve life, but they just have a completely different viewpoint than what most of us in the animal welfare world is. It's just, we just want the animals to be able to, you know, we want to take care of them and we want them to live and have good lives. So we're going to expand the topic from animal control in the health department to also talk in general about local government and animal control, of course, and then public safety, which would be local, state, and maybe even some federal agencies. And then another group that you've really got to spend a lot of time thinking about are all your other animal welfare entities, be it TNR individuals or small groups, be it cat rescuers and 501c3 shelters and just all the different foster-based programs, and those individuals and how difficult each of those can be, or not difficult, maybe just again may have a different viewpoint. And then of course don't forget veterinarians. But what you have to remember is that a return to field program is absolutely vital and such an amazing thing for your community, and it needs to be started as soon as possible. So this kind of shows you where I've come from, and I'm one of these directors that have been around. This fall, I've been around 20 years, and there's not a lot of us that have been around a long time. And many people tend to move around too, and I've been in the same place. I started in 2002, in the fall of 2002. So here, in 2022, I've been here the 20 years. So you can see from a cat standpoint, there's been a radical change. And so much of that was associated with 2015, I had a consultant, actually 2014, we had a consultant come in and really help us learn how to shift our focus to community cats and lower our adoption fees, and really work even harder with our fosters and foster finders. And you can just see what changed. It's really amazing to me. So let's talk about some definitions. Who are community cats? And I think some of the problem we have when we communicate with our stakeholders is they may have little bits and pieces of what return to field might be, and maybe some of them aren't that specifically interested in all the details, but they know a bit, or they know a little bit. So first we want to explain to them who community cats are. And I think when we talk about our animal welfare groups and TNR groups, cat rescuers, there's a lot of different definitions just within our own group versus even when you start talking about your other stakeholders, which would be animal control or your board of health. So what are community cats? And it's really important that we're all really clear and we try to all communicate the same thing. So a community cat is a feral outdoor cat. It's a friendly outdoor cat, and it's pretty much anything in between cat. For us here, we consider anything over 2 pounds potentially to be a community cat. So even a young cat can be. These cats live outside. Sometimes they go in multiple homes. They vary in the way that they act in the community, is between friendly and very wild, and they may act differently at each household that they go to. But regardless of their personality or sociability, they're considered community cats. So some of the definitions that you might want to consider that your stakeholders need to know, or at least you understand, and what we're going to talk about mainly today would be return to field. And that means cats that are brought into your animal control or the place where your stray cats or your trapped cats or your feral cats are housed. And that agency is the one that determines what happens to them or what pathway they find. For us and for me, it's us, it's animal control. And some communities, it's going to be your local humane society. It may even be a cat rescue group that I've seen, that in multiple states where the dogs go to one agency and the cats go to all to a different. And then understanding that trap, neuter, release is different than return to field, and that shelter, neuter, return is another definition that's out there that pretty much emulates return to field. So where are these cats? These cats are, mainly pet cats, and these numbers are all pretty unknown. We probably have a pretty good handle on how many pet cats there are. We think there's between 75 and 95 million pet cats, and most of those are sterilized. And I think the number we really have no idea of knowing, and y'all probably talked about it somewhat yesterday and today, is how many community cats are there. And it is an unknown. I think the big takeaway here from this slide is that only 2% are sterilized, and that a tiny, tiny percentage of these community cats are in these colonies that you hear about, these large groups of cats, anywhere from 5, 10, 20, 30, 40, 50, 100. that are being fed by one individual group of people, and they kind of live in a certain area. And it's what a lot of the conflict ends up being about, especially with your government, is that's what they think of when they talk about community cats. They're thinking of that person that has cats all over their house and spilling into all the neighborhood. So, who are our stakeholders? And this is a pretty good list of everyone who might be involved. And it's good to think about all the stakeholders, because you may be thinking, okay, I want to start return to field in my community. All those cats that go into where the stray cats are being taken when they're trapped or rounded up, or brought, removed from locations. I just want to save those cats' lives. But as you go about trying to get that started, you have to remember how many people may bump over and say, hey, we're uncomfortable with that, or hey, we're concerned, or why aren't we involved in sharing our vision? So you want to make sure you remember all of them. I think many times people go straight to the animal control, and if animal control is associated with a city or county, you go straight to government. But you have to remember all these people play an important role and have opinions and need to be involved. So we're going to go through each of these and just talk about them. Municipalities. So municipalities, for me, we have a mayor. Most cities are going to have a mayor and city councils. Some times it's going to be county animal control. I mean, a county that's handled it, they're going to have commissioners and a head of a commissioner. And then sometimes it's metro, and the county might be in charge of all of that. So most of them, because they're being funded by tax dollars, they have very specific goals. They don't want their constituents to have any complaints. They're there to service their constituents, and they want to make sure they take care of them, and they want to solve their complaints, and they want to solve it very quickly often. And they really like no complaints. And I'll tell you, being in my role as an animal, as the director of animal control, even 20 years into it, I still often feel anxiety when I get, complaints. You really just don't want complaints. And I work really hard to make sure that none of us are defensive when we have complaints that come in. Also, you don't want to, governments talk about not wasting resources, and many times because you're approaching them for financial, you may need an ordinance changed, a law changed, permission, or you need money. They are very particular about money, and a lot of times they don't want to invest money into the animals. That depends on where you are. We have so many wonderful examples now of communities and cities that are spending large amounts of money on making sure that their animals are treated humanely and fairly, and that their lives are valued. But here in North Alabama, we're saving 97% of our cats, 95% of our dogs, but all my surrounding counties are still very much where I was 20 years ago, and not faulting them, but they are still in the old animal control mode pretty much of rounding up, housing, and then sadly euthanizing most of them. So it just really depends on who your subject matter is, whether they're going to feel confident about investing money into cat spay and neuter or not confident. Municipalities are also going to be very concerned about public safety and hopefully animal safety. So your health department. Now here in Alabama, our health department is very much concerned about these three items, which would be public safety, minimizing infectious disease spread, and animal bites. And they are solely focused on that. And I did not have any pushback at all, nor, I just explained what we were doing. There were no questions, and we moved on. But there are many areas where your local or your state and even federal may really be one of your most key important players, and they are going to be solely focused on their concerns. So public safety is going to be bites from wildlife and domestic animals, and then minimizing infectious disease spread. What I see with return to field and how you talk with them about community cats and how spaying and neutering and returning your community cats is so vital is that every cat gets a rabies shot. And they're using this method more and more, especially with feral street dogs all across the globe, and proving how it really is helping, even if those dogs aren't getting vaccinated the second year. Also, when you're doing a good return to field program and you've got animal control involved, you're going to also have more resources available to your community, such as humane traps, so that instead of that person trying to corral that cat into a carrier to get at the spay and neuter it needs, they're going to be able to borrow a humane trap and get the cat trapped, get the cat to you, and then get it returned. So you just, again, have to remember where your health department's coming from, what's their perspective. Animal control and enforcement, if animal control and enforcement is associated with the shelter that's housing the animals, I think you have a little more ability to influence them, because the director and the leadership there, if they're doing and associated with return to field, they are going to have more control over your animal control officers and explain to them why this is such a vital program. For us and for most animal control enforcement, you have to remember that every day the cat call they're getting is, please come trap these cats. Please come trap these cats. I don't want this cat on my property. So something like 95, 99% of their influence and the calls that they're getting are negative associated with cats, that people don't want the cats. And so it tends to affect the way they feel about returning cats dramatically. They just cannot see your vision at all. And the best thing to do for them is to share other animal control and other cities that have executed these programs and how well they've worked. So I got to live this, and it was really amazing. I was really nervous as we started return to field. I suspected that we would have problems with complainants. So here we're going to be trapping cats, or they're going to be bringing cats in, and then we're going to be spaying and neutering them and bringing them right back to the same location. Of course, with the consultation we had and with the information I'd read, every article I read, they said you're not going to have a problem, but you're still nervous about it. And of course you do. You end up having some problems, but you solve them. And so making sure your animal control officers have the tools they need when they do get complaints specifically about a certain group of cats or a certain one cat that's been returned, and how to deal with that is really important. And of course, every one of those problems can deal with. Every once in a while, you do have to retrap the cat and remove it, but most of the time, feeding the animals or changing, making sure you've got everybody spayed and neutered, or one of the little sound machines, or one of the water sprayers that when the cat comes on that person's property. So every issue can be solved, every one of them. So, and another thing to recognize and to share with animal control is we've been trying to round up, house, and destroy animals for decades, 100 years. And it's just a tragic cycle that doesn't work. But now that we're working with these new models, they actually are working very well. And return to field is a sustainable resolution for all involved, and such a humane method. And they're going to take a lot of pride in that and get a lot of kudos from so much of the community as they move forward. It's going to reduce the amount of calls they have to just nuisance cats, and it's going to allow the officers to do what they really want to do, which is true public safety and true animal safety type calls. So they're going to have their jobs are going to be more rewarding as they get moved toward return to field. So our community definitely doesn't want lethal resolution, and you may have a few people that out yell or out share or out show up at council meetings that are not interested in the animals' lives being saved, but when you get out and start talking with people, even the person whose cat keeps jumping on their brand new Jeep and scratching it, they really don't want the cats to die. It's just period. They don't. They want the animals to have life. They just may not want them on their property. And so the community wants what you want, and so use them, but be ready for the one individual or the two or the three that show up at every council meeting or are really upset with you. Another example would be someone that brings you a stray cat and you choose for it to be returned as a community cat, and that was not what they wanted. They wanted the cat to find a new home, a new indoor home, because they were concerned about the weather or you know, even though the cat's body score is a 5 and in beautiful condition and grooming itself, they want the cat to have a home. So I've gotten really difficult pushback on in both groups. Your animal welfare folks that want cats to have homes, but it does benefit. So this is Rhino. This is my steer. And here I am. He's a miniature zebu and a miniature Jersey. And I just kind of popped him up here because not many people are riding cows, but you can ride a cow. And I think when you work with your TNR groups and your rescue groups, your shelters, they can be really hard. They have a lot of different opinions about who and what should be returned and what community cats are. And the big thing is just to keep those lines of communication open. Veterinarians, to me, have seemed like they're getting a lot better. I think they're getting more information when they go to conferences, and many of them are involved with TNR groups and return to field spaying and neutering, and they're just becoming more and more on board with, and of course they don't want animals euthanized. So I think it's doing better. Definitely one thing to keep sharing with all your stakeholders is that return to field is responsible public policy, except the one thing you need to make sure in some situations is your feeding guidelines. Make sure people are putting food out responsibly when they're supposed to, and not just feeding, you know, wildlife. So one thing to remember is the 3 Ps: perspective, patience, and persistence. And remember, you need to look at your stakeholders' perspective. Remember, you have a lot of stakeholders, and all of their perspectives are keen over what yours is. You've got to think about theirs. Be patient, and you have to be persistent. And I saw that in my transition as we went from stopping euthanizing the cats to saving all their lives. I had several people that were very patient with me, but they were persistent, and they never alienated me, and they listened to me. They listened to the anxieties and fears I had and the concerns I had about financing. But they did all 3 of these, but they did not give up. So just very briefly, I spoke a little too long. What I did in Huntsville is I had groups working with me in 12 and 13, and they challenged me to start returning or spaying and vaccinating and returning a small percentage of my cats every week. And that's how I started. We would do 5 or 10 a week because my funding was so tight at that time. And what happened is I ended up getting a really fabulous city administrator who was on board with life saving. And I often shame on me for not pushing harder sooner with my previous city administrators because I know I could have gotten more. I just was nervous, and they were already improving my budget every year, but could I have gotten there sooner? I think I could have, but I ended up having this city administrator who said, what do you need? I told him. He was supportive. He changed my budget, and we just embraced spaying and neutering all our community cats and returning them all to where they came from. Or, you know, a tiny percentage did have to be rehomed into barn homes or go into the adoption program. So it just was fabulous. The thing that's interesting is right as all this was starting and I was getting a new city administrator, we started doing return to field without an ordinance and without really talking to my city administrator about it, because I wanted to see how it went. And I wanted to make sure that what the theory that we weren't going to have problems indeed was the truth, and it was. So when the new city administrator came, he and I were talking, and I said, look, you know, for a year now, I've been returning a percentage of my cats, and all I need now is the money to do all of them. And so he gave me the money, and we ended up going a full 4 years before we went to the legal and then to city council and actually passed an ordinance. And so we had all the data. We had, you know, we could prove for sure that there wasn't any conflict for the constituents, and that when there was conflict for constituents, that we could solve it, which we had. So I don't know if waiting 4 years was necessary at all. I think we probably could have taken a year worth of data, but I do think we got better as we went along. And you know, after about 3 years, it's sort of old hat. It's an easy program to run. Saving Cats in general is a very easy program to run. You either, you know, you just plan their pathway. They're either going to go on the adoption or they're going to go return to field. And then you always have one, and instead of it being, oh my gosh, another one, it's always kind of exciting. Right now we have a gorgeous white and black long-haired cat who also has cerebral hypoplasia. He also is temperamental, and if you touch him wrong or pick him up wrong, he's going to bite you. And then he has some inappropriate elimination. So we're trying to figure out where he's going to go. You know, for his own safety. And most likely, you know, he's going to find a very particular home that is going to love saving his life. So because he doesn't really fit into the adoption program, and he does not fit in the return to field program. So here are some resources, and there's my email. Please reach out to me. I know this is a very quick overview, and I've gone over, and so I'm going to stop now.
Thank you so much, Dr. Sheppard. That was great. Lots of information. And yes, we have 1 minute here. And so, no, this is fine. It's all great information. And I'll leave this slide up for that full minute. Everybody will have the slide in their handout. So all these resources are available there, but it's great. Most of the comments were about being very inspired, and, you know, it's great information. Unfortunately, I am going to have to skip questions, but thank you, Dr. Sheppard. It was great.